Well, back with Dr. Gold from Connecticut. Dr. Gold, so we know that you're doing LASIK surgery as well. That's literally all you do. Besides, of course, you do dispense glasses, prescribe glasses, and do lenses and that type of stuff, and do the whole examination to find out what's wrong in the first place. But and I hear on radio constantly, when I drive here in California, there seems to be one or two doctors who advertise, and everybody says, LASIK, go and get your LASIK done. And frankly, I don't know why I would go and do a LASIK, simply because I don't know what it fixes. So tell us, please, what does a LASIK surgery fix? What does it not fix? Can you do that, please? Can you shed some light on that?
Laser vision correction can eliminate nearsightedness, farsightedness, and astigmatism.
And what is astigmatism? What is that?
In astigmatism, the optical surfaces of the eye are not particularly round. They're more shaped like a football. And that causes blurred vision. So
it causes what? Say that again.
It causes a significant blur of the vision.
Blurred vision. So people, like a fog, like whatever.
Well, it's not really a fog. There are other eye problems that cause foggy vision, but blur is you just don't see the edges of things sharply.
Got it.
You can't focus well.
Got it.
So it interferes with driving, it interferes with seeing television, it interferes with reading, working on the computer, seeing movies. And all of these things are interfered with by either nearsightedness or farsightedness or astigmatism. In nearsightedness, people can see close up, but they can't see far away without their glasses or contact lenses.
Okay.
In farsightedness, it's just the reverse. And in astigmatism, the vision is blurred at all times. So
I see. So it wouldn't matter. So basically, astigmatism, a person who is farsighted can have it, and a person who is nearsighted can have it.
Yes.
And a person who is normal-sighted can have it.
Yes. Astigmatism can coexist with nearsightedness or farsightedness, or just be the only visual problem.
Got it. Now, let me ask you this. I do need reading glasses, and I don't need reading glasses if I'm sitting in a sunny day at Starbucks outside. For some reason, I can read that thing then. But second gets a little darker, I need reading glasses. Do I have any of the symptoms which LASIK can fix?
Yes. The reason that you can see better in the bright light is basically a photographic or an optics principle. When the pupil of your eye, like the diaphragm in a camera, gets smaller, you can see better. Bright light of sunlight or bright reading light inside creates a smaller pupil, and so you can see better. So that's not a disease, it's just an aging change of the eye in which the focusing muscle starts losing its ability to change the focus of the lens of the eye. That's called presbyopia.
And it can be fixed. It can be fixed with LASIK surgery.
Yes, we fix it with laser vision correction by making one eye, the non-dominant eye, typically, a little bit nearsighted, so you can read. You keep both eyes open at all times. It's called monovision, and it takes more time for the doctor to explain that to the patient and to test the patient for it to make sure the brain will tolerate it. And so the majority of LASIK surgeons don't bother with it, but I do. And so I treat a lot of patients from our area for monovision with laser vision correction.
So basically, if I would do this operation, needing reading glasses, which frankly I'd rather not, for many reasons. Do you understand? Good looking, I'm a very vain guy, as you can see, is one of them. And I don't look intelligent with glasses because, if you're not, you don't look like that, so it doesn't really matter what you put on. But anyway, the point is, I'd rather not, if I don't have to. So it would work for me. Tell me this, how long would it last? A year, 2, 10, forever? What are we talking about? Does it depend on the age you are, or what's the deal there?
Once you're dependent on reading glasses, monovision lasts indefinitely. It does not wear off. Monovision does not wear off. So if you were to have it done, of course you'd have to get on an airplane and fly to Connecticut for me to do it, but it's indefinite.
It's included in the price, right? The air flight.
Yeah, absolutely.
All right. So basically, if a guy who needs reading glasses, whatever that is called, what is it called? A guy who needs reading glasses?
Presbyopia.
Okay. So a guy who needs reading glasses, I won't pronounce the word you just said. A guy who needs reading glasses can get a Lasik surgery and be done as long as his life lasts, except if he might be, not getting any other diseases in his eyes, I suppose.
That's exactly correct.
Wonderful. That's great. So, a blur vision is an indicator. I'm not so sure it's 100% for sure, but it's an indicator that a person has stigmatism and that a person can't be fixing it with LASIK. A far-sighted person, which is a person who sees only things in the far or only things in the near, what do I know?
Only sees far away.
Only sees far away. So I drive on the highway and I see the turn-off signal in Connecticut here from California. That would make me a far-sighted person, right?
Right, but you wouldn't be able to see your dashboard.
Yeah, that's bad. That's really bad. So I could use LASIK if I have that.
Yes.
Good. The other way around, I can see the dashboard perfectly, but I can't see the exit sign 60 feet down the road. I could use LASIK.
Yes.
Beautiful. Because that's a lots of people having that type of problem. I think, I don't know, but tell me, more people have those type of 3 problems we now mentioned. Well, 4 really, in my opinion. Need reading glasses, blur vision, far-sighted or nearsightedness. And then they have glaucoma and cataracts and that type of stuff, I assume. I'm not sure.
Yeah, that's clearly true. The statistics are that about a quarter of our population is nearsighted. About a half are farsighted. Most of those people also have at least a little bit of astigmatism.
Got it.
And almost everybody, once they reach the age of 45, will develop the need for reading glasses or presbyopia.
Okay. I'm 58 now. And I used them for about, I think 6 years now. I don't know, maybe 7, give or take. So, all right. Well, wonderful. Thank you very much for your, what I think. It was very educational to me. I hope it is educational for the people watching this video. So there is really hope. So LASIK surgery in all 4 cases lasts kind of forever. It's not kind of going away and then getting worse because of it and you can't do it anymore. It just, once it's done, it's set in stone and again, more or less, except some whatever funny other things.
More or less, yes.
And wouldn't matter what the age is. 50, 30, 60, it wouldn't matter.
No, there's no upper age limit. The only upper age issues are if the person is developing cataracts, LASIK is not a good idea. The younger age limit, I will not operate on anybody under 18, and I need proof in the form of their former eye records that their vision has finished changing, that their growth has finished for at least 3 years.
Well, that makes sense. That makes perfect sense. It's like with an orthodontist. There's no reason to start ortho work when the baby teeth are still coming out.
Right.
Obviously. Well, thank you very much, Dr. Gold.